On the occasion of World COPD Day, let me speak few points regarding the COPD. COPD or chronic obstructive pulmonary disease is a common, treatable and preventable disease which is mainly caused because of the smoking, pollution and biomass fuel exposure, especially in the middle income countries like India and Asian countries. Main biomass exposure is because of firewood, which is commonly practiced in rural areas, and cow dung, and it is preventable because as we know, the latest government schemes for introducing LPG, which is compulsory, which prevents COPD diseases like this. And the theme for 24 COPD day is let us know the lung function. Why it is important is, if you come to know the lung function early, it is easy to treat and prevent the complications further, and patients can have better quality of life. And the symptoms look like, say, similar to bronchial asthma, but entirely different. The treatment is entirely different compared to the asthma, especially in the earlier stages. The later stages both look same, but earlier stages entirely different. There is an entity called early COPD, where the lung functions will be normal and patients will have symptoms, especially the smokers. And it is important to treat those patients to prevent progression of the disease. And there is another entity called acute exacerbation of COPD, where it is an increase in symptoms of routine things like breathlessness, cough, and this is usually occurs because of the viral infections and exposure to the common irritants like smoking and pollution. And COPD is preventable because mainly it is caused by smoking and pollution. The main thing we advise when the person comes is quitting of smoking, which is very important, and treat the symptoms adequately and properly. And other thing is the government should take adequate scheme to prevent pollution and prevent biomass fuel exposure, especially in the rural women. And better to consult a specialist when you notice the symptoms of COPD and asthma, because if you go to a general practitioner or some local practitioners, they will treat you as asthma.
Chronic obstructive pulmonary disease is a progressive lung condition which causes a lot of severe breathing difficulty and restriction in the airflow. Its most commonest cause is smoking, and of course we do see a lot of patients who have been affected by pollution. It is important for younger people to know that smoking affects the lungs in the long run, and it is imperative that they stop smoking with immediate effect. Once set in, COPD does not let you live peacefully, hence it's important that you all have to take care. Immunocompromised individuals must be extra careful. For example, people who are diabetic and who have other associated diseases like hypertension, heart disease, or elevated cholesterol levels must also be careful and make sure that they are being screened and treated for COPD.